Hemodynamic shock can affect multiple different organs, and thus there are many different useful labs that you can find that are used for diagnosis as well as determining the severity of shock. And determining the severity and knowing what shock it is will allow a physician to better treat a patient who has shock. But if there are so many different labs, how can we really decide what to do for a patient who comes in with shock? And what should we really be looking for? Well, a patient with shock will most commonly have a blood pressure that is noted to be very low. In fact, if a patient has a systolic blood pressure of less than 80 millimeters of mercury, it's very dangerous. And so physicians often try to replete the fluids, but at the same time, they're going to want to check different labs to figure out what's going on. Why does this patient have such a low blood pressure? So I have a system that helps me remember what diagnostic tools are used, and it all actually makes sense when you think about what is happening to a patient who has shock. So first of all, you want to know how the cardiovascular system is functioning. If a patient has low blood pressure, you have to wonder, is there something wrong with the heart? Or maybe it's more of a vascular problem. Remember, the mean arterial pressure is equal to cardiac output times systemic vascular resistance. So that's cardiac output times resistance. So is something wrong with the cardiac output? Well, how can we check that? Of course, there are many different ways. One, we might want to get a cardiac ultrasound. And what a cardiac ultrasound does is essentially scans the heart to look and see if it's contracting properly. Is it squeezing enough blood out into the system? Or is the pump itself in some way dysfunctional? So that's really what you're looking at with an echocardiogram. It's just an ultrasound of the heart. Also, to figure out, maybe a patient has a heart attack, you might be looking for troponins. Now, elevated troponins will mean that a patient has a myocardial infarction, which is a heart attack. Another thing you often see in shock is measurement of pulmonary capillary wedge pressure. Pulmonary capillary wedge pressure. Now, what is that? Essentially, what you're doing is you place a device that extends to the pulmonary capillaries. So there's a device called a Swan-Ganz catheter that you feed through maybe a brachial vein and get through the superior vena cava into the right atrium of the heart, into the right ventricle of the heart, into the pulmonary arteries, and you wedge it really far down into where the pulmonary capillaries are. And the Swan-Ganz catheter kind of has a balloon at the tip of it to allow it to expand and wedge itself in the pulmonary capillaries. And this allows it to gather a pressure. So what is this pressure that this catheter is feeling? Well, let's take a look at the lungs. So let me go ahead and reveal the lungs here. So let's imagine the heart isn't contracting properly. So like we were seeing before, blood is supposed to squeeze up from the left ventricle out the aorta and down to the body and up to the head or the arms as well. So the left side of the heart pumps to the system, whereas the right side of the heart pumps to the lungs. Now, if the heart isn't functioning properly, you won't be able to pump fluid forward as effectively. So essentially, blood will back up and accumulate in the left ventricle, and that will further back up into the left atrium, and that will further back up into the lungs from the pulmonary veins. Now, this backup of blood creates a pressure on the system, and that's exactly what we're measuring when we're looking for the pulmonary capillary wedge pressure. We're measuring the pressure that's built from this backup of the left ventricle not being able to function correctly. So this gives us great information to tell us how well the heart is functioning. What's very important about the pulmonary capillary wedge pressure is it can tell us what type of shock it may be. Cardiogenic shock is going to have an increased pulmonary capillary wedge pressure because the heart's not pumping. However, something like hypovolemic shock, where you just have low blood volume, the heart should still be able to function properly, and pulmonary capillary wedge pressure will be low. The next question we might want to ask ourselves is, how well is the blood oxygenated, and how well are the tissues extracting oxygen? Now I'm going to go ahead and clean up some of what we wrote out, so I can show you a couple other tools that can help us in shock. Now, so here I have revealed both lungs and the heart, and you can see a little bit of the liver that I've had drawn, and I'll talk about that a little bit later. So we looked at the heart. Now to focus on oxygenation. One test that we will commonly do in essentially all types of shock is get an ABG. This is known as an arterial blood gas. This will tell us how much oxygen, the pressure of oxygen, is in the body, and it'll also tell us how much CO2 is in the body. It'll also give us an indication of how acidic the blood is. So a physician might get an ABG to check what the PO2 is. If it's too low, if it's less than 60, then that's not enough oxygen in the blood to allow delivery to the tissues. But this is a very important test. That's the main point you should take away from this. An ABG is essential in shock. Another important lab value is called the mixed venous oxygen saturation. It's also written as SMVO2, or just MVO2. And this is important because whether it's high or whether it's low from normal can help you differentiate what type of shock the patient is experiencing. Now, a normal MVO2 is about 60 to 80%. You're probably more familiar with something called an O2 sat, or O2 saturation, measured with a pulse ox. You put a little applicator on a patient's hand, the pulse ox, and you measure the O2 sat. And usually you're seeing values around 92 to 100% being normal. But remember, this is after the blood has passed to the cells of the body, so it's going to be a little bit lower. And again, if we look at our diagram of the heart, the mixed venous oxygen saturation is a collection from the superior vena cava and the inferior vena cava. Once this blood mixes, the oxygen saturation equilibrates. And so you have a general average of what the total body venous oxygen is. And like I said, if it's less than or above normal, it might give you a certain indication of what shock you may be dealing with. So we've talked about functioning of the cardiovascular system, what tests to use there. We've talked about oxygen saturation. Now next, we're going to talk about organ dysfunction. So there are many tests you can look at for your different organs to see if there's damage. Because if shock goes on long enough, tissues get starved of oxygen, cells will start to die. So I'm going to zoom out to get a better look at the bigger picture. And we'll go ahead and reveal some of the different organs. One test that you can use is known as the blood urea nitrogen. If it's elevated, it tells us that our kidneys might not be functioning as correctly. So blood urea nitrogen is BUN. Along with that, you can also get a creatinine. And same thing, both of these give an indication of how well the kidneys are functioning. And of course, there's the good old-fashioned way, checking urine output. Decreased urine output can tell you that a patient's kidneys may be failing, and they may need more fluid resuscitation. Other lab tests you can check are liver function tests, particularly coagulation studies. So the liver produces most all of your coagulation factors, and so looking at the PTT and the INR, basically two values that allow you to figure out how well the patient's blood is clotting, can give you an idea whether or not the coagulation factors are normal. So you can look at the kidney, you can look at the liver, complete blood count, CBC, so this is blood count, may also give you an indication of how much blood is in the system. Maybe the reason the body can't deliver oxygen effectively is there's low blood cells. And last of all, one of the most important tests is the lactic acid level in the serum. As the cells of the body are deprived of oxygen, they have to create energy without oxygen. So O2, along with glucose, is used to create energy. However, when oxygen is lacking, you can still create energy with glucose, but a byproduct is lactic acid. So higher levels of lactic acid mean that the body has been starved from oxygen for a longer period of time. So really, for every single shock, serum lactic acid or serum lactate is very important to get. If I were to pin it down to just maybe two labs, lactic acid and ABG to assess the oxygen level are probably the most important labs to get initially. The idea here is not to get lost in the amount of different labs that there are, but to understand that shock really affects the entire body, and there are many different labs you can take a look at to figure out what's going on with a patient. Remember to break it down. Look at the cardiovascular system. Is it functioning correctly? Is the heart pumping? Look at the oxygenation, and look at the end organ damage. Are any organs damaged from prolonged lack of oxygen? Once you figure this out, treatment of shock will really be dependent on what type of shock it is. But most often treatment will focus on increasing the blood pressure by perhaps giving fluids or giving packed red blood cells if necessary, or also using pressors. Both of these are good at increasing the systemic vascular resistance. So the idea behind fluid is to increase the blood volume to maintain blood pressure. The idea of pressors is to clamp down on blood vessels and decrease the diameter. This will increase the resistance, which will also increase the blood pressure. And of course, don't forget the ABCs: airway, breathing, and circulation. A patient should be properly ventilated to get the oxygen he or she needs to be able to survive hemodynamic shock.